In this skill, I'm going to show how to flush a central line. So the first thing I'm going to do is I'm going to come into the patient's room and wash my hands. I'm going to ask them their name and their date of birth. And then I'm going to assess the site. I'm going to look if there's any redness, swelling, if it hurts, if there's any other complications with our dressing. And then I'm going to put on my gloves. And I have all of my supplies here. So I have site scrubs, heparin if it were the policy. I have normal saline syringes. I would also have caps if it were my agency's policy to change the caps during when I'm flushing. But the first thing I'm going to do is I'm going to take a scrub hub and I'm going to scrub for 15 seconds, watching the clock. Watching for 15 seconds. So once I have cleaned, I can take my normal saline syringe and prime it. And then once this is dry, I can attach, unclamp, and then I can push a little and pull back for blood return. I can see that I have blood return, and then I can flush with the push-pause method of whatever my facility's policy is. For this, it's 10 milliliters. And I can detach my syringe. And now if I were to heparin lock this, I would take another side scrub and scrub for 15 seconds, watching the clock. For 15 seconds, and then waiting for that to dry, I would take my primed heparin, whatever my facility's policy was, and once this is dry, I can attach my syringe and unclamp, and I'm going to push that using the push-pause method. And while I'm pushing these, I'm just going to be assessing my site, asking my patient how they're doing, and everything like that. And then I'm also going to scrub one more time even when I'm done, for 15 seconds, watching the clock. Not every facility will require heparin, but you just have to check the policy. And then again, if it were my policy, I would change the caps. If I were changing this PosiFlow, I would make sure that I prime it first. And once I've scrubbed that for 15 seconds and I changed my caps if I needed to, I'm done. So I would document how much I flushed, if I got blood return, if I used heparin. I would document how the site looks, if I were to need a dressing change, if I hooked it back up to anything, if I gave any medications or anything like that.